Malaria, one of the oldest and most lethal diseases in human history, has shaped societies across the globe from ancient times to the present. This disease, caused by the Plasmodium parasite and transmitted through the bites of infected female Anopheles mosquitoes, has a historical presence that dates back thousands of years. The origins of malaria are believed to be in Africa, where the combination of warm climates and large, stagnant water bodies provided an ideal breeding ground for the mosquitoes that carry the Plasmodium parasite. Historical records, including ancient texts and genetic studies, suggest that malaria was already a well-known scourge in ancient civilizations across Africa, Asia, and the Mediterranean, including Egypt and Greece. As global exploration and trade expanded, so did malaria. The disease was carried along the Silk Road in Asia, across the Mediterranean, and into the Americas by European colonizers and African slaves. Each new territory presented a conducive environment for the spread of malaria, primarily due to the introduction of Anopheles mosquitoes. The widespread prevalence of malaria can be attributed to several factors. First, the resilience and adaptability of the Anopheles mosquitoes allowed them to thrive in diverse environments, from tropical rainforests to temperate swamps. Second, socioeconomic conditions often limited effective public health measures in many parts of the world, especially in poorer regions where standing water could not be easily controlled, and healthcare infrastructure was inadequate. Moreover, malaria parasites have shown remarkable genetic flexibility, enabling them to develop resistance to multiple anti-malarial drugs over the decades. This resistance has made controlling and eliminating malaria significantly challenging, despite numerous global health efforts and initiatives. Today, malaria remains a major public health challenge, particularly in sub-Saharan Africa and parts of Asia and Latin America. According to the World Health Organization, there were an estimated 241 million cases of malaria worldwide in 2020, leading to over 600,000 deaths, predominantly among children under 5 years of age in Africa. The fight against malaria has involved a combination of strategies including mosquito control efforts, such as the use of insecticide-treated nets and indoor residual spraying, and medical interventions like anti-malarial medications and the development of malaria vaccines. The recent approval of the RTS-SAS01 Mosquirix vaccine by the WHO marks a significant milestone in the fight against malaria, offering hope for better control and eventual eradication. Malaria has long been a devastating force in human history, impacting millions of lives and influencing the economic and social structures of vast regions, particularly in tropical and subtropical areas. The damage wrought by this disease is not just measured in human suffering but also in its substantial economic impacts, especially in heavily affected regions like sub-Saharan Africa. Throughout history, malaria has been a leading cause of death and disability worldwide. In the 20th century, it was estimated to have killed more people than all wars combined, with the most vulnerable being children under 5 and pregnant women. These groups are particularly susceptible to severe forms of malaria, which can lead to death or significant health complications. Economically, malaria imposes a heavy burden on healthcare systems, reduces life expectancy, and diminishes workforce productivity, leading to persistent cycles of poverty and underdevelopment in affected countries. The economic growth in these regions can be hampered significantly, with some estimates suggesting a reduction in GDP growth by as much as 1.3% annually in countries with high malaria transmission. The battle against malaria involves multiple strategies focused on mosquito control, medicinal prevention, public education, and international cooperation. Controlling mosquito populations, the vectors of malaria, is crucial. This is achieved through environmental management such as draining stagnant water where mosquitoes breed, using insecticides, and introducing larvicide-eating fish into water sources. Personal protective measures like indoor residual spraying and insecticide-treated mosquito nets are also widely adopted to protect individuals and communities. In terms of medical intervention, prophylactic antimalarial drugs are recommended for travelers and residents in high-risk areas, helping prevent the development of the malaria parasite in the human body. Public health campaigns are vital in educating communities about malaria prevention techniques, the importance of using mosquito nets, recognizing the symptoms of malaria, and the necessity of seeking prompt medical treatment. Advancements in research and development also play a critical role in the fight against malaria. The development of new and more effective anti-malarial drugs and the introduction of vaccines like RTS-SAS01, Mosquirix, the first to gain WHO approval, represent significant progress, even though the vaccine isn't fully effective in preventing the disease. It has, however, been instrumental in reducing the severity and mortality of cases. Moreover, international collaboration and support are essential, with global initiatives such as the World Health Organization's Global Malaria Program and the RBM Partnership to End Malaria driving international efforts to combat the disease. These organizations help in mobilizing resources, distributing mosquito nets and medicines, funding research, and implementing public health interventions in malaria-burdened countries. While the scale of damage caused by malaria remains significant, particularly in less developed parts of the world, the continued efforts in prevention and control have led to notable reductions in malaria cases and deaths over the past 2 decades. With ongoing advances in medical technologies and enhanced health systems, the global community remains hopeful in its long-term goal of eventually eliminating this age-old disease. Malaria continues to pose a significant global health challenge, rooted in centuries of history and widespread across tropical regions. Originally prevalent in environments conducive to Anopheles mosquitoes, which transmit the malaria parasite, the disease today heavily affects sub-Saharan Africa while also persisting in parts of Asia, Latin America, and, to a lesser extent, the Middle East and Europe. Significant progress has been made in reducing the global impact of malaria, but it still claims hundreds of thousands of lives each year, particularly among children under 5 in Africa. The battle against malaria is compounded by issues such as drug and insecticide resistance, and socio-economic barriers like poverty, inadequate healthcare infrastructure, and insufficient public health measures. The multifaceted approach to preventing and controlling malaria involves a combination of personal protection, community initiatives, public health policies, and ongoing research. Personal and home protection. One of the most effective personal protection methods against malaria is the use of insecticide-treated mosquito nets, ITNs. These nets not only prevent mosquito bites but also kill the insects upon contact, significantly reducing transmission rates. Indoor residual spraying, IRS, complements ITNs by applying insecticides to the interior surfaces of dwellings, killing mosquitoes that contact these surfaces and further decreasing the mosquito population. Environmental management. Managing the environment to control mosquito populations involves draining stagnant water where mosquitoes breed and covering water storage containers to prevent egg laying. These measures are particularly crucial in urban and densely populated areas where standing water can be common. Medicinal interventions. Anti-malarial medications play a crucial role in prevention, especially for travelers to malaria-endemic regions and residents in high-risk areas during peak transmission seasons. These medications can prevent the development of the disease in those exposed to the parasite. Community involvement and education. Educating communities on the importance of malaria prevention and control strategies is fundamental. Engaging communities in the use and maintenance of ITNs, participation in IRS programs, and environmental management practices ensures the sustainability of malaria control efforts. Research and development. Continued research into effective antimalarial drugs and vaccines is critical. The development and pilot implementation of the RTS-SAS01 vaccine, known as Mosquirix, represents a promising advance in malaria prevention. This vaccine has shown efficacy in reducing the severity of malaria cases and is a significant step toward controlling and eventually eliminating malaria. Despite improvements, malaria remains a severe public health issue requiring sustained and integrated efforts to further reduce its impact. The combination of effective prevention strategies, global health initiatives, local community engagement, and innovative research is key to the ongoing fight against malaria. Through concerted efforts and international cooperation, the goal of malaria elimination becomes increasingly attainable.